You feel fine. Until one day, you don't. You feel fine. You wake up. You stretch. You sip your morning coffee. Life seems normal. Until one day, it isn't. Your vision blurs. Your arm goes numb. You collapse on the floor. And in that moment, a silent killer finally shows its face. What is this silent killer? It's high blood pressure, clinically known as hypertension. And here's the terrifying part. Nearly 1 out of every 2 adults in the United States has it. Yet most people don't even know it. Unlike pain, fever, or fatigue, high blood pressure gives no warning signs. It creeps in slowly, quietly, silently damaging your heart, arteries, brain, kidneys, and even your eyes, years before any symptoms appear. It's called the silent killer for a reason, because by the time you feel it, it may already be too late. What exactly happens inside your body? Imagine your blood vessels as garden hoses. Now imagine you turn up the water pressure, just a little, every day. You don't see the damage right away, but over time, the pressure stretches the hose walls, weakens their structure, causes cracks and tears. Inside your body, this is exactly what happens. Your artery walls stiffen and narrow. The heart works harder, eventually enlarging and weakening. Blood flow to vital organs becomes restricted. You're at high risk for heart attack, stroke, kidney failure, and blindness. And yet, people live years with high blood pressure and feel totally normal. That's the trap. The danger often starts at 130/80ths and gets progressively worse. But here's the scary part. Most people with stage 1 or 2 hypertension have no symptoms at all. They go to work, cook dinner, laugh with friends, until one day a stroke hits. Who's at risk? While hypertension can strike at any age, it becomes far more dangerous after 65. In fact, over 70% of adults, age 65 plus in the US have high blood pressure. It's a major cause of dementia, stroke, and heart failure in the elderly. But it's not just age. You're at risk if you are overweight, eat too much salt, smoke, drink alcohol excessively, live with chronic stress, have a family history of hypertension, or live a sedentary lifestyle. The combination of modern diet, lack of movement, and emotional stress is a ticking time bomb. The day everything changes. Let me share with you a true patient story. Let's call him Mr. Howard. Mr. Howard was 68 years old, retired, active, laughed often. He had what he called a strong heart. No meds, no health complaints, never visited the doctor. He believed he didn't need to. One evening, while watching his favorite show, he suddenly couldn't speak clearly. Then his right arm dropped. Then came the fall. By the time the ambulance arrived, the damage was done. A massive ischemic stroke caused by uncontrolled, undiagnosed hypertension. He had been living with stage 2 high blood pressure for years without knowing. So, what can you do right now? The answer is both simple and life-saving. Know your numbers. Just like checking your bank account to avoid overdraft, you must check your blood pressure regularly, especially if you're over 50. You can do this at home with an automatic BP monitor, pharmacies or health fairs, primary care checkups. And once you know your numbers, don't ignore them. If your blood pressure is even slightly elevated, it's time to take it seriously. Myth pound 1, if I don't feel sick, I must be okay. Let's start with the biggest lie of them all. High blood pressure doesn't cause pain. It doesn't cause fatigue. It doesn't warn you until one day it causes a stroke, or a heart attack, or kidney failure. By then, the damage is permanent. That's why it's called the silent killer, because it whispers and then it strikes. Myth pound 2, I take my pills, so I'm safe. Medications help, yes, but they're not magic. Many people believe taking a blood pressure pill in the morning means they can eat anything, stay sedentary, and still be protected. That's a dangerous assumption. Medication controls the symptom, but it doesn't cure the underlying cause. Myth pound 3, it runs in my family. There's nothing I can do. Yes, genetics matter, but they're only one piece of the puzzle. Studies show that even people with a strong family history of hypertension can reduce their risk dramatically through daily habits. Genes load the gun, but your lifestyle pulls the trigger. 5 natural ways to lower blood pressure. So, what can you do, starting today, to protect yourself and your loved ones? Here are 5 proven, doctor-approved strategies that work with or without medication. Cut the salt, not the flavor. Excess sodium is like pouring gasoline on a fire. Causes your body to retain water, which increases blood volume and raises pressure on your arteries. The American Heart Association recommends less than 1,500 milligrams of sodium per day for adults with high blood pressure. Tips: avoid processed foods, they're sodium bombs. Choose fresh ingredients and herbs for flavor: garlic, lemon, rosemary. Be cautious with canned soups, sauces, deli meats, and snacks. Even reducing salt by 20% can drop systolic BP by 5-10 millimeters of mercury. Move more, sit less. Your heart is a muscle, and like all muscles, it needs training. Regular physical activity strengthens the heart, improves blood flow, lowers stress, reduces systolic BP by 9 millimeters of mercury. Simple plan: 30 minutes of moderate exercise, brisk walking, swimming, dancing, 5 days a week. Break it into 10-minute chunks if needed. Add light stretching or Tai Chi for flexibility and relaxation. Bonus: exercise also improves mood and sleep, both linked to blood pressure. And without lifestyle changes, your blood pressure can still creep up, despite the pills. Eat like you love your heart. The DASH diet. The DASH diet, dietary approaches to stop hypertension, is one of the most studied and effective plans for lowering blood pressure. It focuses on fruits and vegetables, whole grains, lean proteins, especially fish, low-fat dairy, nuts, seeds, and legumes, and it limits saturated fat, sugar, sodium. This diet alone can reduce systolic BP by 8-14 millimeters of mercury. That's better than some medications. Master your stress, or it will master you. Stress triggers the fight or flight response. When activated daily, it keeps your body in a state of high alert. Heart rate increases, blood vessels constrict, blood pressure rises. Chronic stress is like constantly pressing the gas pedal, without letting up. Solutions: practice deep breathing, 5-10 minutes daily. Journal or talk to someone you trust. Prioritize sleep. Disconnect from negative news and toxic environments. Try mindfulness, meditation, or prayer. Even 5 minutes of stillness each day can reset your nervous system. Lose even a little weight. Big benefits. Excess weight forces your heart to work harder. Losing just 10 pounds can reduce blood pressure significantly. Set realistic goals. Focus on waist size. Aim for less than 40 inches, men, and less than 35 inches, women. Combine healthy eating plus movement. Avoid extreme diets. They rarely work long-term. Weight loss is one of the most powerful natural tools in your arsenal. I've had patients who thought it was too late. They were over 70, on multiple medications, tired of trying. But when we made small, steady lifestyle changes, they saw real results: lower blood pressure, more energy, better sleep, a renewed sense of control. You're never too old to protect your heart, and you're never too young to start. The hidden triggers of high blood pressure. What you don't know is hurting you. It's 6:30 a.m. You've barely started your day, but your blood pressure, it's already spiking. Welcome to the most dangerous time of the day for people with high blood pressure: early morning. Morning surges, the hidden danger. Did you know that most strokes, heart attacks, and cardiac arrests happen between 6 a.m. and noon? This is due to a phenomenon called the morning surge, a natural increase in blood pressure that occurs when you wake up. Why? Your body releases stress hormones like cortisol and adrenaline to get you going. Your heart rate increases. Your blood vessels tighten. Your blood becomes slightly thicker in the morning. For someone with normal blood pressure, it's manageable. But if you already have hypertension, it's a recipe for disaster. Tip: if you take medication, ask your doctor whether you should take it at night to blunt the morning surge. Surprise culprit. Pound 1. Sleep apnea. You may think high blood pressure is just about diet and exercise, but one of the most overlooked causes is poor sleep, especially sleep apnea. This condition causes your breathing to repeatedly stop and start while you sleep, often without you knowing. Warning signs: loud snoring, daytime fatigue, gasping or choking during sleep, morning headaches. Sleep apnea deprives your body of oxygen, causing your blood vessels to constrict and your blood pressure to spike every night. Solution: get evaluated at a sleep center. Treating sleep apnea, e.g., with a CPAP machine, can dramatically lower your blood pressure, especially at night and early morning. Surprise culprit pound 2. Medications you might be taking. Yes, some drugs you take for other conditions may unknowingly raise your blood pressure. Common culprits include NSAIDs like ibuprofen and naproxen, decongestants found in cold and flu medications like pseudoephedrine, certain antidepressants, steroids, birth control pills for women still on hormone therapy, even caffeine-heavy supplements or energy boosters. Tip: always read labels and ask your doctor or pharmacist, does this affect my blood pressure? Surprise culprit pound 3. Hidden salt in healthy-looking foods. You may think you're eating healthy, but salt is sneaky. Even health foods like canned vegetables, whole wheat bread, salad dressings, veggie chips, protein bars, low-fat, frozen meals can contain massive amounts of sodium. Pro tip: read the nutrition label. If sodium greater than 300 milligrams per serving, skip it. Aim for less than 1,500 milligrams per day total if you have high blood pressure. How to measure blood pressure correctly? Most people do it wrong. Let's get this straight. If you check your blood pressure at home but do it wrong, the numbers lie. Here's the correct way to measure. Sit quietly for 5 minutes before measuring. Feet flat on the floor, back supported, arms supported at heart level. No caffeine, smoking, or exercise 30 minutes prior. Use a well-calibrated upper arm monitor. Avoid wrist or finger types. Take 2-3 readings, 1 minute apart, and record the average. Accuracy matters. One false reading could mean months of wrong treatment. Why you should keep a blood pressure log. High blood pressure fluctuates throughout the day. A single reading doesn't tell the full story. A logbook helps you and your doctor spot patterns, like morning spikes, post-meal surges, or evening crashes. What to record: date and time, systolic, diastolic values, pulse. Notes: for example, after exercise, feeling stressed, poor sleep. Even 7-14 days of logs can reveal what blood tests can't. Watch out for these everyday habits. Here are small habits that raise your BP without you noticing. Holding your breath during heavy lifting, checking stressful emails right after waking, drinking more than 2 cups of coffee per day, skipping meals causes adrenaline release, binge watching TV for hours without movement. Each may seem minor, but over time, they compound your risk. I had a patient, Mrs. Elena, 72. Blood pressure was never consistent. Medication worked, sometimes. Other times, not at all. We discovered she snacked on instant noodles for lunch. She took ibuprofen daily for joint pain, and she only checked her BP after walking the dog uphill. By fixing these invisible problems, we lowered her systolic BP by 22 points without changing her medication. Awareness saved her brain, her heart, and her independence. Take back control. Your heart, your future. The daily blueprint to outsmart high blood pressure. High blood pressure doesn't care about your age. It doesn't care about your excuses. But you know what? It also doesn't stand a chance if you fight back. Not every high reading is an emergency, but it's important to know when to take action. If your BP is above 180/120ths and you experience chest pain, shortness of breath, numbness, confusion, blurred vision, go to the ER. Don't wait. What to ask your doctor? Too many people leave the doctor's office with more confusion than answers. Don't let that be you. Here are 5 key questions you should always ask. What's my current BP? And what's my target? Are there any underlying causes for my hypertension? Can I manage this with lifestyle changes alone? or do I need medication? Are any of my current medications raising my blood pressure? How often should I monitor at home? And what number should make me call you? Be your own advocate. Your doctor is a guide, but you drive the journey. The blood pressure blueprint, your daily game plan. Want real results? Start small. Repeat daily. Here's a simple, doctor-designed plan anyone can follow. Morning, 6 to 9 a.m. Take BP medication, if prescribed. Drink a glass of water first thing. Do 5 minutes of deep breathing or quiet time. Eat a low-sodium, high-fiber breakfast, oatmeal, berries, boiled egg. Avoid checking emails or jumping straight into stress. Midday, 11 a.m. to 2 p.m. Take a brisk 10-15 minutes walk. Choose a DASH-friendly lunch, grilled salmon, salad, brown rice. Check your BP if your doctor advised daytime monitoring. Take 5 deep breaths before eating, lowers cortisol. Avoid high-salt fast foods, even when rushed. Evening, 5 to 8 p.m. Light stretching or tai chi. Cook dinner with herbs instead of salt. Disconnect from screens at least 1 hour before bed. Write down one thing you're grateful for. Lowers mental stress. No caffeine after 2 p.m. Avoid alcohol at dinner. Night, 9 to 10 p.m. Take meds, if prescribed for nighttime dosing. Check BP1 last time, optional. Dim the lights. No phone in bed. Sleep 7-8 hours. Your arteries heal during rest. Sleep is blood pressure's secret weapon. Tools that help you stay on track. Home BP monitor, arm cuff, automatic, memory function, notebook or app. Track your BP, meals, mood, meds. Kitchen scale plus measuring spoons. Manage salt intake. Support system, spouse, friend, caregiver. Someone to keep you accountable. Your tools don't have to be expensive, just consistent. It's never too late to start. I once had a patient, Mr. Daniels, 74 years old, on 3 medications. Tired, frustrated, ready to give up. We didn't overhaul his life overnight. We made one small change per week. Week 1, switched from canned soup to homemade. Week 2, 10-minute daily walk. Week 3, cut out soda. Week 4, started morning breathing practice. In 3 months, his BP dropped from 156/90 to 128/80. He reduced one of his meds. But more than that, he felt alive again. I didn't think I had control anymore, he told me. But now I realize, I do. If you've made it this far, you've already done the hardest part. Facing the truth. High blood pressure is scary, yes. But it's not unbeatable. Not if you know your numbers. Stay consistent. Ask for help. And most of all, believe that change is possible. This isn't about avoiding death. It's about choosing life. Vibrant, energetic, fulfilling life. Your future isn't written in your blood pressure. It's written in your daily decisions. Start today.